In this video, we'll discuss the importance of testing somatosensory cortex, how this is tested, and locations of different sensory parts in the brain, how do they reach from peripheral sites to the brain, and the effects produced by a lesion of the somatosensory cortex and different parts sensory cortex that control sensations, and how they reach the brain from peripheral site, and the effects produced by a lesion of the somatosensory cortex or its pathway, and the effects produced by a lesion of these parts. Tests for assessing somatosensory cortex functions are stereognosis, two-point discrimination, graphesthesia, tactile localization, and recognition of texture. So where is the somatosensory cortex? Somatosensory cortex is in the area 312 of the post-central gyrus of the parietal lobe, a strip that runs parallel to and behind the central sulcus. The other sensory area is in the Sylvian fissure Brodmann area 40. In addition, somatosensory association area Brodmann area 5 and 7 is also important in recognition, function, and dysfunction of the somatosensory cortex. Somatosensory association area is behind the sensory cortex and receives afferent from primary sensory cortex. Why evaluating sensation is unreliable, and what are the prerequisites or requirements for reliable cortical function test? Evaluation of sensation is unreliable because it's subjective and cannot be evaluated. In uncooperative patients and those who lack understanding of the test, it's useless. But in compliant and discerning patients, sensory examination can be extremely reliable to localize a lesion. 5 sensory modalities of light touch, pain, temperature, vibration, and joint position sensations are tested in each limb. Primary sensations should be intact. Testing cortical sensation is only meaningful when primary sensation is intact. So what are the types of sensation? There are 2 types of sensations, superficial and deep. Superficial sensations are of pain, temperature, light touch, pressure, and are carried from the skin and subcutaneous tissue. Deep sensations are proprioception and position sense and vibration, and receptor for these are in the joint, muscle, tendon, and ligaments. Which sensations are responsible to test the sensory cortical function? It's a combined function of both superficial and deep sensation of touch, vibration, and position. So how touch proprioception pathway travel up to the sensory cortex? Touch pathway have 2 routes and 2 different type. It's the fine or discriminative touch sensation which, along with position and vibration sensations, is responsible for sensory cortex functioning. And how do they reach there? They reach the sensory cortex via dorsal column. Dorsal column first order neurons are in dorsal root ganglia, enter the spinal cord, and travel through the posterior column in the fasciculus cuneatus and fasciculus gracilis ipsilaterally from upper and lower half of the body respectively up to medulla. So they go ipsilaterally up to medulla and relay in the nucleus cuneatus and nucleus gracilis, and then cross over to the opposite side as medial lemniscal system as second order neurons to the thalamus, and then to the contralateral sensory cortex as third order neuron to the cerebral cortex. Without a dorsal column lesion, these abnormalities suggest lesion in the sensory cortex of the parietal lobe. A lesion of the somatosensory cortex causes contralateral loss of discriminative sensation of 2-point discrimination, touch localization, conscious proprioception, stereognosis, and graphesthesia. Abnormalities of these tests signify cortical or thalamocortical projections lesion. With a specific parietal cortical lesion, loss of function is in the opposite side, so both sides should be tested separately. With parietal cortex lesions, most prominent symptoms are contralateral hemi-neglect, hemi-inattention, and a tendency to not to use the hand and arm of that side. What's proprioception? Proprioception is a position sense in the space and tested by moving joints in different directions. And what's Romberg test? Romberg test is a sensory test which is positive in neurosyphilis. How do you do that? Patients stand with feet close to each other with open eyes and then asked to close eyes. If patient sways or loses balance or falls, then the test is positive. With parietal lobe lesions, patient is unable to identify the stimulus on the contralateral side when both hands are touch. So important point from examination point of view are that somatosensory cortex is area 312 is in the post-central gyrus of the parietal lobe. Other sensory area is the sylvian fissure, and the association area is behind the sensory cortex and receives afferent from primary sensory cortex. Evaluation is difficult because it's subjective and cannot be evaluated, and testing sensory cortical function is only meaningful when primary sensations are intact, and sensory sensation are tested by touch, vibration and position senses by dorsal column with the first order neuron to ipsilaterally to medulla oblongata, cross over to thalamus, from thalamus opposite sensory cortex. So what are the effects of lesions of somatosensory cortex? It causes contralateral loss of discriminative sensation, loss of function on the opposite side, contralateral hemi-neglect, hemi-inattention, and a tendency to not to use the hand and arm of that side.